Have you ever known anybody double jointed? Maybe they pulled their wrist back maybe they pulled their thumb back and made it touch their wrist, or maybe you noticed that their elbows and their knees went a little bit further than what might be considered normal. Well, there's actually a medical term for this. Joints that can extend past their normal range of motion are known as hypermobile. And while it's very normal for somebody to have at least one hypermobile joint, what's less common is for it to be all joints or for it to cause pain. When this is the case, this person might have joint hypermobility syndrome, or JHS for short. I was diagnosed with JHS in the summer of 2025 and have been receiving physical therapy for the symptoms since February of 2025. I didn't even know what it was, and so without the support from my primary doctor and my physical therapist, I wouldn't have even been able to get my diagnosis. I hope that through this presentation, you might be able to learn about JHS, and should somebody you know display these symptoms, you might be able to tell them a bit about it, since spotting JHS is very important. Unmanaged JHS can cause continuous injury, fatigue, and pain, as it is a chronic condition and requires management. So to start us off, we'll be looking at what exactly JHS is, and from there we'll go on to what these symptoms you can spot are. And then we'll look at how these are managed. So what exactly is JHS? Well, the most known feature is obviously the ability to push one's joints past the standard or comfortable position. According to the Cleveland Clinic, the flexibility is caused by weakened or loose ligaments, which are the thick straps of tissue that keep joints in formation. When these cannot properly support the joint or let them leave formation, the job of that turns to the muscle, which may not be trained to handle that naturally. While the exact cause is unknown, the National Library of Medicine states that the likely cause could be related to genetic changes in the proteins that control flexibility and strength in the joints, ligaments, and tendons, such as collagen. This would cause a dysregulated membrane, which has already been related to various diseases, including cancer, cardiovascular diseases, and neurological disorders. It is hypothesized that this could also be the cause of JHS. While the exact cause for these genetic abnormalities may be unknown, the symptoms are very clear. The most apparent of them being continuous injury. When the ligament, according to the Cleveland Clinic, when the ligaments are unable to fully support the joints, they will often fall out of motion, and thus untrained individuals who are not managing their symptoms will often have injuries based around joints falling out of place, like ankle sprains. And while not as apparent, other symptoms regarding quality of life are also important. The Hospital for Special Surgeries lists out many of these symptoms, such as pain after activity and at night, muscle joint and stiffness post-injury, constant fatigue, clicking joints, and especially in children, difficulty with handwriting as well as coordination and balance. While these symptoms may not be as disruptive as continuous injury, it is a chronic condition and needs to be managed appropriately to have the best quality of life and avoid those injuries. Due to the nature of JHS, routes after diagnosis rely mainly on management rather than treatment, since there isn't really a cure, since it affects almost all ligaments in the body, and therefore all the joints. So the main method of management is physical therapy, according to the Cleveland Clinic. The therapist will be able to assess patterns, recognize exercises, create plans, and also contact your primary doctor should you display abnormal symptoms. They will also be able to track your progress, so you know how much longer you might be able to keep up with physical therapy before you can move on to self-management. Speaking of self-management, the clinic will also recommend several lifestyle changes in order to reduce pain. They mostly rely on consciously avoiding hyperextending, such as fixing posture, standing with bent knees, as I have been doing during this presentation, and use of orthopedics to help correct flat feet, which I also have in these shoes. However, these are not fixes and require practice and the strengthening of muscles to step up for the weak ligaments. While bending your knees can help prevent putting strain on those joints, you also have to use your muscles to make sure that you're standing in the correct position. And without training those muscles, they can also cause pain and exhaustion, which adds to the chronic fatigue. This is not to be used in replacement for physical therapy, but rather alongside it or after physical therapy when you have been cleared by your primary and your physical therapist. Despite being a chronic genetic condition, joint hypermobility syndrome symptoms can be managed through physical therapy and lifestyle changes. So the next time you see somebody double jointed, know how important it is to understand the possible risks of this party trick.